I am here at the crisis line at the Harris Center talking with Jennifer Battle, who will explain exactly everything they do up here.
Hi, Madison. We're so glad you're here today. This is the crisis line. As you mentioned, we're here 24 hours a day, 365 days a year to talk to people who may need some support. We talk to people who are experiencing mental health symptoms. We talk to people whose loved ones are worried about them. We talk to people who may be experiencing suicidal ideation. Whatever the need that they have is, we're happy to be here to talk with them.
So what is the goal for the crisis line?
Our goal is to answer every call that comes in a warm, caring, and compassionate way. We really want people to not be nervous or scared to reach out to us, because the goal of the crisis line specialist who takes the call is to really help the person either begin their journey into mental health care and services. We can connect them to resources. We can connect them to our agency, to other services in the community, but we can also just be that listening ear. Sometimes people really just need an opportunity to sort of put voice to their feelings. And if you've been sitting with some thoughts that you haven't really had a chance to explore out loud, exploring those with a crisis line specialist is a great way to get started, because then that can help encourage you maybe to talk to your parents or friends or family members or school counselors or whatever the next step is for you.
I am here in the adult mental health outpatient clinic with Dr. Hill.
Good afternoon, Madison. How are you?
I'm great. How are you?
Great. Welcome to our floor.
Thank you. It's nice to be here.
All right. Well, do you know much about the adult mental health process and how to get started, how to get enrolled if you want services?
I learned a little bit on the floor of the crisis line in the Access Center, but could you tell me a little bit more?
Absolutely. When we look at the services that we offer, the clinic itself, we host over 2,700 clients for mental health services. Wow. So being able to at least offer services for counseling, for nursing, for medications, for therapy, for substance abuse is very, very impactful to the community. When it comes down to services, peers working closely with the client who's getting services really makes a difference. Our peers are ones who are working at the agency who have lived experience. And it really makes a difference in terms of impact when you can say, let me introduce you to one of our peers who does group work, who can normalize how you feel or normalize what you've experienced over the years. It really does make a complete difference.
Now I am here with Tiffany Brooks, Director of Children and Adolescent Services.
We provide cognitive behavioral therapy services, skills training, case management, psychiatric services, and medication training and supports. We provide services to not only the children, but also their families.
Still here at the Children and Adolescent Services, we have Tina Griffith, who is a peer and family partner. Can you explain a little bit of what that means?
Sure. Basically, I'm one of the first people that the folks see when they come off the elevator, and I have the lived experience to help them navigate the system. Not only have I navigated this system, but others as well. That's my peer role. My family partner role, I do have a child with a diagnosis, so I have also navigated systems for him as well. Okay. So I'm there to give our families a sense of being and welcoming.
To learn more about this and all the other programs the Harris Center provides, please call 713-970-7000 or visit theharriscenter.org.